WJZ, Maryland's news station.
All right, still ahead on Eyewitness News Sunday morning. We're taking a look at the newest invention in helping to treat knee pain, and we'll have more with the professionals who can tell us all about the bionic knee coming up.
Well, osteoarthritis affects more than 27 million people nationwide every year. Now there is a revolutionary way to treat it.
That's right. Dr. Ronald Delannoy is here, and we're also joined by
Donna Shores.
Donna Shores from Sinai Hospital, the Rubin Institute, and they're talking to us about the newest technology, the bionic knee. Well, first off, good morning to you both.
Good morning. Good morning.
Come closer. You're far away.
Tell
All right,
us
so
about
how does this work?
Well, you know, the way it works is really in two effects. One is a brace that functions as an unloader. What that means is it takes the pressure from one side of the knee and shifts it to the other side of the knee. So from the bad side to the good side. Okay. And the second method is by creating an electrical signal. There's two pads. There's one that's across the front of the knee, and there's another pad that's in the top of the knee, and it creates an electrical signal that travels through the joint to hopefully actually increase or improve the pain.
Aren't people doing that naturally? When you have that pain, you kind of shift your weight to the good side, isn't?
You do. That's exactly right. But we generally can't shift enough. So this helps shift it to a better position.
I see. So you're shifting, but it's really not good for you on your own.
Well, no, it's not. That's, you know, everybody will shift and they'll try to accommodate, and that's not a bad thing.
Okay.
Shifting, we do this with a little bit more with the brace.
Okay, gotcha.
Now, this comes with a controller. We showed a little bit about it, of it during the tease here, but show us how this all works. So you're actually wearing it.
It attaches to your belt.
Okay. And I see a bunch of controls there. So are you actually, I mean, motion by motion by motion, pushing the buttons to get it to, how does that work?
You set it at a function level where you feel the current, and then you decrease it until you don't feel it.
Wow.
So what kind of patient would develop something like this? You
know, our osteoarthritis is really pervasive in our culture. So, you know, it's on the rise. So a lot of patients actually develop osteoarthritis, and really there are not a lot of great options for it. And this is just another alternative treatment to hopefully preventing a knee replacement.
Now, is it more of a sports injury, or is it just kind of as you're maturing?
Yeah, that's a great way to put it. You know, I think that people get osteoarthritis for a number of reasons, some of which are sports related, some of them which are age-related. You know, we're a definitely more active society now. We're a larger society now. All these things contribute to earlier and earlier arthritis. We want to remain active, so this will help us remain active.
Okay. Now, Donna, you're a patient, actually, who is suffering with osteoarthritis. How has this actually enhanced your movement, enhanced your life?
Gave me my life back.
Really?
I'm able to spend time with my grandchildren. I was able to go trick-or-treating for 3 hours without any pain. I don't have any pain.
Really?
I don't have any pain at all. It's complete, and I've only been wearing it 4 weeks.
Wow.
300 hours.
Is the goal to eventually get them off of the bionic knee where they improve?
Well, the goal is always to get people off of braces, but the reality is that they're probably going to have some type of maintenance in terms of use of the brace, and that's okay, because if I can prevent them from getting a knee replacement for a longer period of time, then they're much happier.
Okay. So now, if you're someone sitting at home and you wonder whether or not you're a candidate for this, how do you determine whether or not the Rubin Institute is for you right now?
I mean, I think you need to come in and see us. Okay. The reality is that you won't know until you come. You get the right x-rays, you get the right evaluation, and then we determine whether or not you're a candidate. You know, if you've got moderate to mild arthritis, I think you're a good candidate for this procedure.
I always think of $6 Million Man running 60 miles an hour, jumping over buildings. Donna, you ready to do that?
I can go up and down steps, which is a miracle, because I couldn't even go up and down steps. I couldn't shop at the grocery store. I couldn't walk.
Oh, wow.
And now I have my life back.
That's a great story.
I can say. It is wonderful. It's a miracle.
Okay.
So you are the bionic woman.
I am. I'm telling you. And it's the best thing I've ever discovered.
All right.
I'm not on any pain medication or anything.
Oh, wow. Great. Now, if folks want to know how to contact you, the website is on the screen. It is www.hips. How do you, let's say that's hips, knees, and shoulders. Hips, knees, and shoulders.com. Hipkneesshoulders.com. And of course, you can see this segment on WJZ.com to get all of this information again, and of course, that website. Doctor, Donna, thank you so much.
Thank you very much
this morning. Great information. And of course, we'll be right back in just a few moments with your 5-day first warning forecast.